It is a huge honor today to be interviewing a real role model of mine, Eric Jackson. I feel like we have so much in common. We're both DDS. We're both masters in the Academy of General Dentistry. We both have our fellowship in International Congress Oral Implantology, and on and on and on and on. And I have really gone to school following you on social media too. I mean, you were the first person I know who you just did it all right. It was your social media posts are educating and informative. I always want to read them, and I can just imagine how your patients wondering. How are you doing today?
I'm doing fantastic. Thank you. Thank you for the kind words. That's fantastic. I mean, coming from someone like yourself with admittedly some of the top posts around, means a lot to me. Thank you.
Oh, hey. And so I want to start off. I mean, there's so many things I could talk to you about. I mean, you're a master clinician. You're an implantologist. You're a successful businessman. You're the top 0.01% social media marketing that I've ever seen, and I've been on social media pretty big time since 1998. So then everybody's wondering, do you screw your crowns to implants or not? We keep hearing a lot that one of the biggest causes of periimplantitis is excess cement, and some implantologists just say they're not cement anymore. What are you doing?
I don't. Well, see, the thing is, obviously with the screw, you're going to have the visible access screw, and then you can use opacers and things like that. But I don't screw. But I do always make a custom abutment. I really want that cement line up as high as possible away from that implant, just like a natural tooth. So whether it's a CAD/CAM brand name like Atlantis or something along those lines, just being able to have a beautiful wide platform that mimics just more or less a perfect ideal crown prep. And then you simply just have to clean around the 0.5 millimeter below the gum line, and you're in great shape. Very predictable. Obviously a nice radiopaque cement so you can see what the heck you're dealing with on the X-rays, and you're in business. But CAD/CAM custom abutments and I go along very well with my implants. I don't use stock abutments.
Eric, how would you answer this? I'm in Phoenix, and there's two dental schools in my backyard. One's in Glendale and one's in Mesa. And when they're in my office, the most common question I get is, the problem they have with implants is the person who usually lost the tooth had decay and gum disease, and they're just thinking, well, what's going to last longer on that missing tooth? The person already has a mouthful of virulent periopathogens, Streptococcus mutans, and what would you say to a kid who said, Eric, the person who lost his tooth had a huge cavity and a bleeding 5 millimeter pocket, and so his mouth's filled with bugs.
Yeah.
What would last longer, an implant and a crown there, or a 3-unit bridge? How would you explain that?
What I would tell those the young dentists would be, it really comes down to what we talked about earlier, a really good comprehensive exam, knowing, has it been 30 years since they're at the dentist? I mean, if they don't have a true value for things, if they don't understand that implants aren't necessarily forever. I mean, you hear it on the radio all the time with the implants, oh, these are forever. Well, they're not unless you take care of them. And even then, they haven't been around that long in their single-rooted form to really be able to make that kind of claim. So that patient better be well-educated, certainly as clean as possible going into it. And then it comes down to, obviously, a lot of patient responsibility. For me, it's funny. I'll have people come to me for implants, and I'll just, I'll joke with them. I'm like, I'm going to talk you out of this implant right now, Mrs. Jones, because you need a bridge on that tooth. Whether it's they're looking at the space, and I'm looking at the space and the neighbors. The two neighbors have 15 pounds of amalgam in them from 1922. It's not going to be very long before those need some help too. Why don't you go with the bridge, Mrs. Jones? Kill two birds with one stone. That's where again, it's full circle. True comprehensive dentistry is multidisciplinary, being able to choose between implant and crown, being able to look at the entire mouth, evaluate the gums, evaluate the flora of the mouth, their past histories. It's a very complex, time-consuming appointment that all happens in that 0150 comprehensive exam.
One of my very good friends, they ear, nose, and throat, and you don't want to get them started on sinus lifts. It's going to be a rant forever. And I think it's funny how dentists say, well, I'll never do a bridge because I don't want to file the enamel off the tooth, and then they'll put half a bucket of sand in the person's sinus. And then my ENT front buddy Gordon saying, no, So it's funny how a dentist, the enamel's sacred, but they'll destroy the sinus. So an ENT is like, leave the sinus alone. It's sacred. File down the teeth. And it's funny how everybody has their own perspective. And as you get older and older and older, you just realize that binomial thinking is a red flag. When someone says always yes, always no, up, down, right, not left, whenever you hear an extremist, you know the truth's in the middle somewhere. And as you get older and older and older, you get more and more moderate and realize that every question is complex. In fact, when I'm asking you questions, I'm half the time thinking, did I ask that question right? I mean, how you ask the question is everything.
You can't, nothing is absolute, right? That's the old saying. And it all comes down to, patient care. Each patient is different. Each treatment plan is different. You have to know both the physical and the emotional backgrounds. You got to know a little bit of everything to truly get that patient what they want. Because in the end, and even then, that might be, I may have misspoke there. It's what they want and what they need and what you can achieve. All these things kind of come together at the end of that appointment. It's a very interesting thing because your ENT friend, there's no one way to do things, and I'm sure there's some definite validity to that opinion, and I'm sure there's some definite validity to the dental aspect of it as well. So it comes down to, you're absolutely right. Being able to do it multiple different ways is imperative.
One of the things that you're a role model and an idol to me is you always have one eye on your patient's needs, but you also have an eye on cost, and you factor that in a big way. Well, Eric, you said you lecture sometimes at your study clubs and stuff.
Yeah, I have.
If you got an hour lecture, I'd give anything to have you put it up on Dental Town.
I'd love to.
Yeah, I would absolutely love that because I just think you're a hell of a guy. You're a hell of a clinician. You're a hell of a social media. I just think you're a hell of a guy. And I just want to tell you, we're 2 minutes over time, but thank you so much for spending an hour with me today. I just think, and thank you for all you do for dentistry and your the CDS Foundation, the DuPage County Health. I mean, everything. You're just a hell of a guy. Thank you so much for spending an hour with me today.
It means a lot coming from a guy like you. You're somebody that I've sat in your lectures and your MBA for dentistry courses and things, and it's just fantastic being able to sit here. This is exactly what I wanted to have when I was young. First year out, second year out, being able to rub elbows with somebody the likes of Howard Farran or the likes of anybody else in that league. I mean, really, we're talking A-list people here, and here I am sitting Skyping with you, and it's fantastic.
Thanks, buddy. Well, thanks, and I hope you have a rockin' hot rest of the day.
You too. Thank you very much.